Today we delve into a fascinating case from the field of medical hematology, focusing on clinical transfusion and the complexities of blood group identification. Our story centers on a 13-year-old boy who was admitted to the hospital with acute severe aplastic anemia. As part of his treatment plan, he was scheduled to receive a blood transfusion. However, what seemed like a routine procedure soon revealed an unexpected twist during his blood type examination. The results showed inconsistencies between his positive and negative ABO blood types, raising immediate questions and setting the stage for a deeper investigation. Patient, a young male with no prior history of blood transfusions or hereditary diseases, presented a unique challenge. His clinical presentation was straightforward: severe aplastic anemia requiring urgent intervention. Yet the blood type results did not match expectations. The medical team quickly realized that this was not a typical case, prompting a thorough review of his medical and family history. This careful assessment was crucial in guiding the next steps and ensuring the patient's safety during transfusion therapy. Blood type identification is a cornerstone of transfusion medicine. In this case, the patient's positive and negative ABO blood types were inconsistent, while his RHD was positive. To unravel this mystery, the medical team extended their investigation to 7 close relatives, testing their ABO blood types for comparison. Antibody screening for the patient was negative, ruling out some common causes of blood type discrepancies. This systematic approach laid the groundwork for a more detailed exploration of the underlying issue. Results from the patient and his 7 close relatives were compiled and analyzed. This family-wide testing provided valuable insights, as patterns began to emerge that hinted at a possible genetic component. The data, summarized in a detailed table, showed that several family members also exhibited unusual blood type results. This finding suggested that the anomaly might not be isolated to the patient alone, but could be part of a broader familial trait. Further clarify the blood type discrepancy, the team conducted specialized serological tests. One such test was the salivary type substance agglutination inhibition test, which involved processing the patient's saliva and mixing it with specific anesera. This test, repeated for all 7 relatives, helped determine the presence of blood group substances in saliva. The results, again summarized in a table, provided more evidence pointing towards a rare blood group subtype. Another key investigation was the absorption radiation test, performed on red blood cells from the patient, his mother, grandfather, and uncle. These cells were washed and exposed to anti-A serum, and the antibody titers in the supernatant were measured. The results revealed that all 4 individuals had red blood cells that could absorb and emit anti-A antibodies, but with a notably weak absorption capacity. This finding was consistent with a rare blood group subtype and provided a crucial clue in the diagnostic puzzle. Saliva tests showed that both the patient and his relatives had normal levels of A and H substances. This result matched the serological characteristics of the AM blood group subtype, a rare variant of the blood type. The presence of these substances in saliva, combined with the weak absorption of anti-A antibodies, strongly suggested that the family carried the AM subtype. This discovery was a significant step forward in understanding the patient's unique blood type. To confirm the serological findings, the team turned to molecular biology. Using the SSB method, they analyzed the ABO genotype of the patient and his affected relatives. The results were clear. All 4 had the AM01 genotype, confirming the presence of the AM subtype at the genetic level. This molecular evidence, combined with the serological and family data, provided a comprehensive picture of the underlying cause of the blood type discrepancy. Detailed family survey was conducted to map the ABO blood type relationships among the patient and his 7 close relatives. The results, illustrated in a family tree diagram, showed that the AM subtype was present in 3 generations. This finding not only confirmed the genetic nature of the subtype, but also highlighted the importance of family studies in diagnosing rare blood group variants. The blood type mystery unraveled, attention returned to the patient's primary diagnosis: severe aplastic anemia. Laboratory tests revealed a hemoglobin level of 54 gl and a platelet count of just 3 × 10⁹ confirming the severity of his condition. These findings underscored the urgent need for transfusion therapy and careful selection of blood products, given his rare blood group subtype. Designing a safe and effective transfusion plan for the patient required careful consideration. The team noted that antibody screening was negative, and there were no irregular anti-A1 antibodies present. This allowed for the use of type O red blood cell suspension or type O washed red blood cells. The plan prioritized safety and compatibility, ensuring that the patient would receive the most appropriate blood products for his unique situation. Transfusion procedure involved administering 2 units of type O washed red blood cells and type apheresis platelets. Throughout the process, the patient's vital signs remained stable, and there were no adverse reactions. This outcome demonstrated the effectiveness of the carefully tailored transfusion plan and highlighted the importance of individualized care in complex cases. 24 hours after the transfusion, the patient's hemoglobin had risen to 73 gl, and his platelet count had increased to 78 × 10⁹. Both red blood cells and platelets were effective, confirming the success of the transfusion. The patient's recovery was closely monitored, and the positive response provided reassurance to both the medical team and the patient's family. ABO blood group system is more complex than most people realize. Beyond the common A, B, O, and OB types, there are numerous subtypes, each with unique genetic and serological characteristics. The AM subtype identified in this case is exceptionally rare and often goes undetected without specialized testing. Understanding these subtypes is crucial for accurate diagnosis and safe transfusion practices. The AM subtype is defined by specific changes in the ABO blood group genes. Unlike temporary changes caused by illness, the AM subtype is inherited and persists throughout life. In this family, the presence of the AM01 genotype in multiple members confirmed the genetic nature of the subtype. This distinction is important as it guides both diagnosis and management. Virologically, the AM subtype is characterized by a lack of agglutination with anti-A or anti-OB sera and the absence of anti-A1 antibodies in the serum. These features make it challenging to identify using standard blood typing methods. Only by combining positive and negative typing as well as specialized absorption and saliva tests can the AM subtype be accurately diagnosed. Family studies play a vital role in identifying rare blood group subtypes. By testing multiple relatives, patterns of inheritance can be established, and the genetic basis of the subtype can be confirmed. In this case, the detection of the AM subtype across 3 generations provided strong evidence for its hereditary nature and underscored the value of comprehensive family investigations. Modern molecular diagnostic techniques such as PCR with sequence-specific primers and gene sequencing have revolutionized blood group identification. These methods allow for precise detection of rare subtypes like AM, providing information that cannot be obtained through serology alone. In this case, molecular testing was essential for confirming the diagnosis and guiding treatment. Blood typing is generally straightforward, but rare subtypes like AM can lead to discrepancies between forward and reverse grouping. These inconsistencies can result in misidentification if only standard tests are used. Awareness of such challenges is crucial for laboratory professionals, especially when dealing with patients who have unusual clinical presentations. Identification of the AM subtype has important clinical implications. It affects the choice of blood products for transfusion and requires careful planning to avoid adverse reactions. In this case, the use of type O washed red blood cells and type A platelets ensured compatibility and safety, demonstrating the importance of individualized transfusion strategies. Saliva testing is a valuable tool in blood group identification, especially for detecting secretor status and the presence of blood group substances. In this case, the detection of normal A and H substances in saliva supported the diagnosis of the AM subtype. This non-invasive test complements serological and molecular methods, providing a more complete picture. Absorption and emission tests help determine the ability of red blood cells to bind and release specific antibodies. In the AM subtype, red blood cells show weak absorption but strong emission of anti-A antibodies. These findings are key to distinguishing AM from other subtypes and ensuring accurate blood group identification. Differentiating between ABO subtypes requires a combination of serological, molecular, and family studies. Each subtype has unique features that must be carefully evaluated. For the AM subtype, the lack of agglutination, specific genetic markers, and family inheritance patterns are distinguishing characteristics. Accurate differentiation is essential for safe transfusion practices. It's important to note that some diseases can temporarily weaken blood group antigens, leading to discrepancies in blood typing. However, these changes are usually reversible and do not involve genetic alterations. In contrast, the AM subtype is a permanent, inherited condition, as confirmed in this case through family and molecular studies. The AM subtype is extremely rare, with only a handful of cases reported worldwide. In some regions, only 2 cases have been detected among hundreds of thousands of individuals. This rarity makes it a diagnostic challenge and highlights the importance of awareness among healthcare professionals. The AM subtype was first reported by Wiener and Gordon in 1956. Since then, only a few cases have been documented, making each new case a valuable addition to medical knowledge. Historical reports have also noted the familial nature of the subtype, with cases spanning multiple generations. Serological testing for ABO subtypes involves a series of specialized assays, including agglutination with various antisera and absorption tests. These methods require expertise and careful interpretation, especially when dealing with rare subtypes like AM. Combining these tests with molecular and family studies ensures the most accurate diagnosis. Molecular genetics has become an indispensable tool in modern transfusion medicine. By analyzing specific gene sequences, clinicians can identify rare blood group subtypes that might be missed by serology alone. In this case, molecular testing provided definitive evidence of the AM subtype, guiding both diagnosis and treatment. Identification of rare blood group subtypes has important implications for blood donation and transfusion services. Donors with rare subtypes like AM may be needed for specific patients, and their blood must be carefully matched. Awareness and proper documentation of such cases help ensure the safety and effectiveness of transfusion therapy. Ensuring transfusion safety in patients with rare blood group subtypes requires meticulous planning. This includes thorough blood type identification, antibody screening, and selection of compatible blood products. In this case, the use of type O washed red blood cells and type A platelets minimized the risk of adverse reactions and ensured a positive outcome. For platelet transfusions, type A is preferred for patients with the AM subtype, with type OB as a secondary option. This approach ensures optimal compatibility and effectiveness. In this case, the patient received 2 therapeutic amounts of type A apheresis platelets, resulting in a successful and safe transfusion. Close monitoring after transfusion is essential, especially in patients with rare blood group subtypes. In this case, the patient's hemoglobin and platelet counts were carefully tracked, and his vital signs remained stable throughout. This vigilance helped ensure a smooth recovery and provided valuable feedback on the effectiveness of the transfusion plan. This case highlights the importance of a multidisciplinary approach in diagnosing and managing rare blood group subtypes. Collaboration between clinicians, laboratory scientists, and geneticists was key to unraveling the mystery and ensuring the patient's safety. Such teamwork is essential for tackling complex medical challenges. Accurate blood typing is critical for safe transfusion practices. Rare subtypes like AM can easily be misidentified as type O if only standard tests are used. This case underscores the need for comprehensive testing and awareness of rare variants among healthcare professionals. The discovery of a rare blood group subtype in a family has implications for genetic counseling. Family members may benefit from testing and counseling to understand their own blood group status and potential risks during medical procedures. This proactive approach can help prevent complications in the future. Advances in molecular biology and genetics are paving the way for more precise and efficient blood typing methods. As technology evolves, the identification of rare subtypes like AM will become easier and more accessible, improving patient safety and expanding our understanding of blood group diversity. Case studies like this one provide valuable learning opportunities for medical professionals. They highlight the complexities of real-world clinical practice and the importance of critical thinking, collaboration, and ongoing education. Sharing such cases helps build a stronger foundation for future healthcare providers. Summary: this case involved a 13-year-old boy with severe aplastic anemia and a rare AM blood group subtype. Through a combination of serological, molecular, and family studies, the medical team was able to accurately diagnose the subtype and provide safe, effective transfusion therapy. The case underscores the importance of comprehensive testing and individualized care in transfusion medicine. For clinicians, this case serves as a reminder to consider rare blood group subtypes when faced with unexplained discrepancies in blood typing. A thorough approach, including family studies and molecular testing, can prevent misdiagnosis and ensure patient safety. Staying informed about advances in transfusion medicine is essential for providing the best possible care. Laboratory professionals play a crucial role in identifying rare blood group subtypes. Attention to detail, familiarity with advanced testing methods, and collaboration with clinicians are key to ensuring accurate results. This case highlights the value of ongoing training and awareness in laboratory medicine. Supporting patients and their families through complex diagnoses is an essential part of medical care. Clear communication, education, and reassurance help build trust and ensure that patients feel informed and involved in their treatment decisions. In this case, the family's cooperation was instrumental in reaching a diagnosis. Cases like this drive progress in transfusion medicine by highlighting the need for advanced diagnostic tools and personalized treatment plans. Ongoing research and collaboration between clinicians, laboratory scientists, and geneticists will continue to improve outcomes for patients with rare blood group subtypes. Reporting and sharing rare cases contributes to the collective knowledge of the medical community. Each case adds to our understanding of blood group diversity and helps refine diagnostic and treatment protocols. This collaborative approach benefits patients worldwide and advances the field as a whole. Conclusion: the case of the 13-year-old boy with the AM blood group subtype illustrates the importance of comprehensive diagnostic approaches in transfusion medicine. Through teamwork, advanced testing, and family involvement, the medical team was able to provide safe and effective care. This case serves as a valuable example for clinicians, laboratory staff, and researchers alike. As we look to the future, continued advancements in molecular diagnostics and personalized medicine will further enhance our ability to identify and manage rare blood group subtypes. Ongoing education, research, and collaboration will ensure that patients receive the highest standard of care, no matter how rare their condition may be.